morning, everyone. I'm Frederica Williams, and it's so wonderful to see all of you here. This is our 22nd year of hosting the annual Men's Health Summit. And I see some of our former Men's Health champion here. I'll get to them later. So thank you for being here as we celebrate and recognize men from our community who are each are men's health champions, and you'll hear from them. As much as this event serves as a recognition of our well-deserving men's health champion, this year will also be an opportunity for us to engage in a very important and timely conversation around men's mental health, with special focus on the state of the youth mental health. The main goal today and every day is to not only start the conversation, but to elevate the conversation and bring mental health or mental illness out of the shadows. This year's theme, Youth Mental Health Awareness, Building Resiliency, Community and Hope, was chosen not only to address the significant youth mental health crisis that percolated before the pandemic and exacerbated during the pandemic, but also to educate and inform each person in attendance today on what we individually and collectively can do to attempt to reverse the downward spiral to help our youth now and in the future. As you will see from the chart on the screen, in the United States, nearly 1 in 5 adults have a mental illness or mental health condition. That's nearly 52 million people. But what does mental health awareness mean? And how do you promote it? Mental health awareness is the ongoing effort to reduce the stigma around mental illness, especially in our big communities, especially in our brown and black community. Hi, Ms. Kankana. I'm doing my CM thing. We have so many Catholic Memorial folks here. To reduce the stigma around mental illness and to increase education on mental health conditions. Often, because of misconceptions about mental health, people suffer in silence and their conditions go untreated. Mental health awareness is an important social movement to improve understanding and acceptance that mental health challenges are real and widespread, and most importantly, they are treatable. We also need to look at the words that we use. We don't go around saying you are diabetic, you are hypertensive, but we say you are crazy, you are loony, you are psycho. So those labels make it difficult for people to seek help when they need it. Pre-pandemic, so this thing just happened during the pandemic. Pre-pandemic, the state of youth mental health was already moving in the wrong direction. The mental health of Black American youth was in a crisis long before COVID-19 devastated the world. In 2019, the Congressional Black Caucus Emergency Task Force on Black Youth Suicide and Mental Health released a report documenting the alarming increases in Black youth suicide rates. That is why I'm so excited that we have another CM graduate here, Wes Woodson, who with his youthfulness will be telling us some of the tools that he has engaged. Hi, Dr. Simon. See, I can recognize people under the mask. The suicide death rates among Black youth have been increasing faster than those of any other racial or ethnic group in America. And Black youth under 13 years old are twice as likely to die by suicide compared to their white peers. Rates of depression and suicidality are also markedly elevated in Hispanic and Latinx youth. According to the Massachusetts 2019 High School Youth Risk Behavior Survey data, almost 41% of Hispanic and Latinx youth report feeling of sadness and hopelessness for almost every day for 2 or more weeks, compared to 33% for all other youths. In Massachusetts, 1 in 5 children aged 0 to 17 reported having at least one mental health condition before the COVID-19 pandemic. So what we've done is we've expanded our school-based partnerships. We're at several schools. We are also going to be adding, we have a fleet of 4 mobile vans. We're going to be adding mental health services so we can do screenings and meet people where they are, and just screening for wellness. Okay, is good? Good, okay. Now it is my pleasure to introduce to you today our Men's Health Champion. Our award recipients today are a diverse group of distinguished and accomplished men whose actions exemplify resiliency, community, and hope. In all of these important work, what is critical, and these are all great things, what is critical is I met Dr. Crawford in 2013. He was on the board of another health center that's not here, and we worked with him and the board to take over those patients. There were about 7,000 patients. And so through his work, we were able to create access for people who would otherwise not have access to care. And during that time, we started having conversations about bringing clinical trials and research to the community and not depending on academic hospitals to give us handouts for research. And last year, we, working with our board of directors, one of our strategic categories was the implementation of a community-based health equity research center at Whittier. And one of the first people I called, we have a director of health equity research now, was Dr. Crawford. Dr. Crawford is a graduate of Prairie View University, University of Texas Medical School, and Harvard University. Dr. Crawford, Whittier is proud to present you with the long overdue 2022 Men's Health Champion for all that you've done in the sciences, but for being a role model to our community and your commitment to that other health center and this health center. Thank you.
I would like to take this opportunity to thank Frederica. I would also like to take the opportunity to thank the citizens of Boston. And I say that is because the citizens of Boston encouraged me to go on. You talked about stress and mental health, but if it wasn't for the disparity that exists inside our community, that in itself inspired me, gave me drive to want to help. I was lucky enough to make it. So now, I say this is because now I work with Prostate Health Education Network. I noticed the number that stood out when we talked about mental health. 1 in 5. 1 in 5 also is a ratio that stands out when it comes to Black men and prostate cancer. 1 in 5. 1, 2, 3, 4, 5, prostate cancer. Another thing that comes into play is a need for men to receive support and guidance from their loved ones, survivors, their communities, centers like this, and PHEN. So what I wanted to do is, again, thank everyone for your support. Thank you for taking the time to be here this morning. And really, also, we are just beginning. With chaos, the pandemic, there then is opportunity for change and growth. So let's change and let's grow. Thank you.
Eddie Jr., CPA, is the president and CEO of Owens Moving Company, which is a third-generation family-owned and operated business specializing in transportation, logistics, storage and warehousing, commercial, and estate investment and development. He is responsible for overseeing the company's day-to-day operations as well as financial planning and analysis. He's an accountant, of course, accounting, treasury, audit, and leading the company's long-term strategy. Prior to joining the family business, Mr. Owens Jr. held various accounting roles at TripAdvisor, Logmein, and Deloitte. He serves on the board of East Cambridge Savings Bank and Massachusetts Growth Capital Corporation. Mr. Owens achieved his master's and bachelor's degree in accounting from our very own Northeastern University, and as I mentioned, is a CPA. Whittier Street Health Center, when we look at the next generation of leaders, Eddie Owens is in that group. And one of the things that he frequently does reach out to say is, how can I help? How can I help the young men? And so for your leadership of supporting the legacy of your grandfather and your father, and now you, we are thrilled to present you, because you are that inspiration. You are that, you're not quite a millennial, you're a little over a millennial, but that next generation.
Good afternoon. How is everyone today? Good. First and foremost, I really want to recognize Frederica. I mean, Frederica is the true health champion. You know, her commitment, her leadership, and what she has done here at Whittier goes without saying. I'd also like to recognize the doctors, the physicians, the staff, and all the volunteers, because without you, this isn't possible. Lastly, thank all of you for being here. It's a beautiful day. It's a Saturday. You didn't have to be here, but you showed up. And thank you for that. Men's health is such an important topic. You know, growing up, I always thought men's health was, I'm going to go to the gym, work out, then have a protein shake. But it's so much more than that. In fact, just to show you how the conversation has shifted, I have a 7-year-old daughter over there. The other day she said, Daddy, when's your physical? I told her August 10th. She went over to her desk, got a pen, and wrote it on her calendar. She then said, Daddy, when's your colonoscopy? So after she said that, the famous last words, well, Mommy already had hers. So I just want to thank Whittier for bringing more awareness about men's health. It's such an important topic, and it's vital that we continue to support and promote this. And thank you, Whittier. Thank you, Frederica. Thank you for everyone for showing up today.
Thank you, Eddie. Our next honoree is Michael Hunter, who is a business development executive at Trinity Financial. Michael is responsible for leading business development activities for Trinity Financial, an affordable and mixed income multifamily developer with offices in Boston and New York. And our partnership with Michael, which goes way back from when he was at the Boston Redevelopment Authority, is critical because in all of the social issues that we're talking about in public health, we talk about social determinants of health. Housing is a critical determinant of health in this community, especially with the cost of rent, where our patients are spending more than 30% of their income on rent. So the partnership with Trinity Financial has been very critical. His efforts have focused on cultivating new client relationships, including organizations that serve diverse populations. Previously, he worked under the administration of Governor Patrick as Undersecretary for Business Development, overseeing the Mass Office of Business Development, Mass Office of International Trade and Investment and Tourism. Throughout his career, he has held various positions in real estate, including serving as Deputy Director at the Boston Redevelopment Authority. Michael currently serves on numerous boards, including the Board of Directors for the Blue Cross Blue Shield of Massachusetts Foundation, whose mission is to expand health care for low-income and vulnerable people in the Commonwealth, and Mass Inc., an organization seeking to advance the regional conversation around economic opportunity and a strong quality of life for all. When we look at the economic gaps, the economic inequities, there was a report that came out in 2015 that said the average net worth of a white person in Boston is $250,000 compared to the average net worth of a black person, that's $8. So when we're asking people to focus on mental health or diabetes or wellness, if there's an economic gap, you're not able to attain those wellness goals. So the work that Michael does is critical to supporting our mission to address health equity. Michael earned a master's in management from the Heller School at Brandeis University and a BA in political science from the College of Holy Cross. Michael also helped, as I mentioned earlier, in guiding us, especially me, in making sure that our construction of this building was within budget and within the timeline. So Michael, for all that you've done for residents of the Commonwealth of Massachusetts, but specifically for Boston residents and Whittier patients, we present you with this 2022 Men's Health Champion.
Frederica, thank you. I'm honored to share this day with folks, and as Eddie pointed out, I know there are other places that folks could be. I think it's a tribute to Frederica and the organization that people have taken the time to come and share this precious moment. I think in passing, this is a real personal experience, personal moment for me. Mental health had a personal impact on my life. My mother would probably have been diagnosed as bipolar when I was growing up. It was very much, mental illness was very much of a bad word. My siblings and I, we went through a foster care system where people had questionable qualifications. They take care of kids. I know that's not true for everybody, but some of us made it out, and some of us didn't. And one of the other things I saw, particularly among men of color as it relates to that mental health, is a significant amount of my friends ended up in the prison system who really had mental health issues. And I think we have to think about all these issues very carefully and figure out ways to bring back social justice in a serious way. And lastly, as Frederica points out, I'm on the Blue Cross Blue Shield Foundation board. I would encourage people to really think about utilizing, their charitable grants as ways to begin to outreach to men, women, the general population in terms of providing greater access to mental health. Again, I'm honored. Thank you very much. We'll talk to you soon.
Michael, thank you for sharing that family history story. I didn't want to be the one to share it, but that's part of why you present hope to our community, so thank you. Our next honoree is Nestor Castro, who came to us as a patient, very quickly became a volunteer outreach ambassador, and I tease Nestor every single day. I mean, talk about leading by example. You won't see Nestor without his suits. He is impeccably dressed. If he's going to be a role model to our patients, he has to represent. So for a while, it took me a while to know who he was, and I walked up to him and I said, what is your name? And he introduced himself. So Nestor came to Boston from New York. After he graduated from high school in 1971, he joined the Army. He was stationed in Japan and was part of Operation Red Hat, unloading ammunition in Vietnam. When he left the Army in 1973, health issues brought Nestor to Boston and to Whittier as a patient in 2013. Nestor came in a challenging health state, and now he credits his ability to walk, run, and go up and down these stairs, and I can tell you he does do that a lot, to the wonderful medical team that he had at Whittier. He currently volunteers as a health ambassador and also works at Walgreens. And one of the things that he said to us is, as he was also looking for housing, which he recently just was able to obtain a housing, but in his role at Walgreens, when a homeless person attempts to steal something because they're hungry and need to eat, as the security personnel, he doesn't arrest them or call the police. He pays for them because he knows hunger hurts.
Anyways, I want to share this with everybody in here and everybody that comes here, because we are all heroes, okay? The staff, the doctors, we're all heroes. We're here day in and day out. But most importantly, the patients. They are heroes, because when they come in here, they might not know, but they might have saved their own life, okay? Don't take stuff for granted. And when another patient brings another patient in here, he becomes a superhero, because he might have saved, or she might have saved somebody else's life. So don't take life for granted. Let's tell you a short story. I'm gonna make it quick. I got a big pain, boom, I can walk, this and that, okay? Went to the hospital, they gave me something to drink, and then next thing you know, it's 3 o'clock in the morning, where did everybody go? I walked out. But when I got the pain again the next time, it was even worse. I couldn't sit, I couldn't stand, I couldn't walk. I was working, and I didn't know how I was gonna get home. But when I did, I went into the hospital, and I see a whole bunch of people running at me, and I'm saying like, what the hell? There he goes. Doctor comes up to me, prep him up. For what? We gotta operate. Now, you're dying. Okay? I was bleeding internally and didn't even know it. Okay? When I woke up, I had staples. I said, what they do, run out of thread? But when I came here, after that, it was hard for me to do. I had to go and off the curb perfectly. And when I came here, because of this clinic, I can walk, I can run, like you said, okay? But most of all, you know, I'm giving back to the community, okay? That's what it's all about, you know? And I appreciate you people in here. And like I said, the patients that come in here, keep coming. You doctors, you patients, or you staff, don't take life for granted. Life is short and it's precious. You need to see a doctor regularly.
Wow.
Okay, it's very important. Thank you, everybody, and this is for you.
Academy Award, there it is. Thank you, Mr. Nestor. Last but definitely not least is Sean Ryan, who's a partner at Husch Blackwell. Sean is a healthcare attorney who delivers legal advice tailored to clients' business strategies. He represents health systems, hospitals, and other healthcare providers, offering guidance on a host of regulatory compliance, governance, contracting, and employment matters. Sean continues to fulfill a general counsel role for many clients today, assisting in-house teams on a daily basis with any matters that arise. Sean also maintains a significant transactional practice in his healthcare practice. Healthcare organizations and other business often come to Sean for strategic transactional advice as they consider how best to structure complex transactions, including mergers and acquisitions, joint ventures, clinical affiliations, and other relationships. Drawing on his extensive knowledge of the industry, Sean helps clients develop growth plans to fit their organizational needs, and he ensures that the transactions he manages serve client goals. As a long-term client of Sean, the Whittier Street Health Center has experienced firsthand that he is enthusiastic about helping clients further their mission. Not only do we go to him for legal advice, we go to him for a variety of strategic decisions. Sean was drawn to healthcare law partly because he enjoys working with mission-oriented clients who are passionate about patient care. I will say that Sean is a graduate of the Boston College High School, and I see him, we didn't click, but he's become a favorite of Whittier Street Health Center. So Sean, for all you've done over the years, it's been almost 20 years.
Thank you, Frederica, and and thank all of you for being here. You know, when Frederica says it's been almost 20 years, it has almost been 20 years. And I have to say in that time, I've been blessed in a lot of ways to have a career in law, but in a career that intersects with healthcare providers. And these are, you know, many of them are extraordinary organizations. They're hospitals, they're clinics, they're physicians, they're researchers, and they all do extraordinary things on a daily basis. But I have to say, the work that I'm most proud of, the association I'm most proud of anything I've done is my relationship with Frederica and with Whittier Street these last 20 years. So Frederica, this award means a great deal to me. In that time, to see Whittier has been an important part of this community for a long, long time. But to see what's happened over the course of the last 20 years, it's really developed into a national model, and it's a model that's recognized around the country. It's held up by the federal government as to what can be accomplished by a community health center. It's always evolving. It's redefining how care can be delivered in the community, what a community health center can do, and it never stops moving. And it's a good thing that that's the case, because the need now is greater than ever, particularly in the area of mental health and behavioral health. And I think it's just so important that Whittier is shining a light on mental health issues, working to remove the stigma that is sometimes associated with mental health issues. And I think it's a great tribute, not just to Whittier, but to all of you in this community, that you would be here today, to address this issue. So thank you very much.
Thank you, Sean. Let us give all of our men's health champions a round of applause. It is now my pleasure to introduce you to our keynote speaker, whom I'm delighted to introduce, Wes Woodson. I am still on the Catholic Memorial email list, and I did not, no, Devin's been gone since 2015, but I saw a newsletter about a young alum of the class of 2016. My son graduated 2015, and the work that he was doing. So I called my son and said, do you know Wes Woodson? And if you know my son for half a second, he told me, Miss Concanon is his teacher, he told me the whole story and said, Mom, you should call him. And I did. And it was a delight to speak to Wes, and he'll share his story with you. He's an author and chief storyteller. He released his book, I Have Anxiety, and So What? In April 2021, in the midst of the pandemic. He's running his own mental health lifestyle brand called The Hidden Company, and signed to be a young adult speaker with Minding Your Mind, a nonprofit raising mental health awareness. He's also the lead storyteller with Dear World, and just launched his own sweatshirt brand, hiddenhoodies.com, to raise mental health awareness. We are grateful to Wes for his advocacy, his leadership, and tireless efforts to raise mental health awareness, and we are honored to have you, Wes, here as our keynote speaker. Ladies and gentlemen, Wes Woodson.
Hello everyone, how are we doing? I am excited to be here with all of you here today. Now, I travel the country and I actually share my story about my own mental health challenges, but I actually have never been in a room with men of color to have this conversation. So I'm so grateful to be here. So a round of applause for everybody for putting this all together. Thank you so much. But I have this conversation with a twist. And what I do is I actually talk about this idea of building mental wealth. And this idea stems from the idea from owning your mental to own your success. I imagine you're sitting there and you're wondering, what the heck is mental wealth? Well, I actually made a definition. See, my definition of mental wealth is this. See my face. But mental wealth is actually the idea of tapping into our emotions, our feelings, to change and reframe the perspective of our life. And I think as men, we have to work on changing our relationship with the word mental health. And that's why I came up with this idea of mental wealth. And the reason why I did so is because I think as men, we think mental health is a scary thing. I mean, we have to put off this image that we have it all well put together all the time. We can't talk about our feelings. We can't talk about our emotions. We have to hide them and suppress them in order to maintain this idea of masculinity. But I think the real story of mental health that we don't really see is this. It's the fact that 1 in 10 of us suffer from anxiety and depression, or that 50%, almost 50% of us, fail to actually be honest about the depression and anxiety that we experience to our loved ones. In fact, like was mentioned before, that we actually die by suicide almost 3 times more than our female partners. Oftentimes behind closed doors, hey, oftentimes when you think you're the only person in the world to ever feel like this. And I think this is a perfect image that represents how men treat mental health challenges. We suppress it. We hide behind the fancy clothes, the fancy car, that job promotion. We put off this image that we have it all well put together. And this was a story I was telling myself every single day of my life. And honestly, if I were to actually accept an Oscar award for being the biggest failure of the year, I get up there, I accept my prize, and I look up everybody and say, you know what? The one person who I have to thank, I would thank my anxiety. Because my anxiety had this way of knowing me even when I didn't know it. And it had this way of always making me feel like I was the only person in the room that felt this way. And honestly, back then, it made me always ask myself this question. Now this question goes like this. Am I good enough? Now I think all of us have asked ourselves that question at least once. Am I good enough? And for me, I ask myself that question almost every single day. And for me, I really realized that as a man, I didn't want anyone to know what was going wrong on the inside. So I remember I had all of these hustles, not the hustles to make money, but the hustles to prove to everyone else that I was good enough. And the first hustle I had, never forget it, I had this idea, I was like, what if I could just change my outward appearance? I mean, what if I could change the clothes that I wore? Maybe everyone would see that nothing's wrong with me. I have it all well put together, right? So what I did was, I took all my saved up birthday money back in 6th grade, and I went to the one place in the world where all the cool kids shopped. You see, I went to Abercrombie & Fitch. Now my idea was at Abercrombie & Fitch, I was gonna buy all the clothes, all the jeans, I was even gonna buy the cologne, because in 6th grade, I was gonna show everyone how cool I actually was. In the next slide, I'm gonna show you what I thought was cool. You ready? All right, I warn you. This right here is what I thought was cool right now. I don't know what I was thinking. Like, do you ever see your old picture of yourself, you just cringe at it? Like, what in the world were you thinking? I mean, for me, when I look back into this photo, 12 years later, I'm aging myself, I see a kid that was willing to do anything. I mean, spend anything, just to be seen as everyone else. But it didn't stop there. I mean, it never does, right? I had another hustle. I was like, what if I ran for class president? Now, I want you to think back to that time when you thought that job promotion or that car or those fancy clothes could help you suppress all those uncomfortable feelings inside. Because for me in 6th grade, I had this idea. I mean, I was like, what if I ran for class president? So while all this is going on, well, Barack Obama, the first US black president, well, he's running for office. And his campaign slogan was, yes, we can. So I convinced my dad to bring me to Staples and make a bunch of posters that said, West, we can. And I won. I won the class election. I felt on top of the world, right? Thank you. But if I'm being honest with you, I really thought I had everyone fooled. I had the cool clothes. I had the class presidency. No one's going to see me as stupid. No one's going to see that something's wrong with me on the outside, right? I mean, everything on the outside is going into my favor. But just as I thought that, just as I thought that. And I had a roommate who actually could see all the negative things that were happening to me. And for me, he could see that the pressure was building up. And you know what his solution was? He was like, Wes, you ever thought about seeing a therapist? And I looked at him, and I was like, what are you, my mom? Like, what are you even saying? But he really thought I should go see a therapist. And I remember I was convinced to go to this mental wellness center in Babson. And I walk in the door, and finding a therapist for me had always been like this. The story of Goldilocks. Now, for those who don't know, white girl breaks into a house, commits a crime, but that's besides the point. Sees 3 bowls of porridge. She tries one bowl, it's too cold. Tries the second bowl of porridge, it's too hot. Tries the last one, opposite the way the story goes, it's just right. Now, my first therapist, Miss Carroll, if she was that bowl of porridge, Miss Carroll would be too cold. Because I'm being honest with you, Miss Carroll, she was too old. She didn't get me. She didn't understand me. She was always telling me how to think and how to feel. But the one thing I want to say about therapy is it's this wonderful experience that helps you understand why you feel the way you feel. And it helps you learn ways to better and healthily manage these unpleasant feelings. But Erin, the therapist, my second one, if she was that bowl of porridge, she would be too hot. Because therapists, well, this one was, she was always trying to fix me. And I didn't really feel heard or listened to. And the biggest thing I want to say about therapy while I have the chance, it's a lot like dating. And I want you to know there are options. Because when I found the one therapist that did work for me, Kelly, when I was in college, I mean, I thought after a few sessions, I could stop. But honestly, on all of this, I ended up turning to people to be honest about my feelings. Because no longer am I trying to be part of that 49% actually before. In fact, my 2 best friends, Cole and Jake, I talk very openly about my anxiety too. And my girlfriend, my very amazing girlfriend, Katie, we talk very openly about my anxiety too. In fact, she reminds me the same thing that Janice told me. That, Wes, it's okay to not be okay. But the biggest asset that I have, well, is my family. And I'm honestly proud to say that because of them, I'm still here. And I want to say thank you so much for listening to my story. But before I go, I want to actually share these 3 things for you. One, you are not weak for getting help. In fact, you are stronger because of it. Two, we're not meant to suffer alone, so we're actually built for connection. And then three, you are all enough. I think as Black men, we don't really hear those words enough, that you are enough. So thank you so much for
Thank you for those words of inspiration. So I'd like to invite Dr. Wright. This was wonderful, Wes. It is now my pleasure to introduce to you my colleague, Dr. Stephen Wright, who is the medical director here at Whittier Street Health Center. He will serve as the moderator. And Wes, I may ask you to pull a chair and join the panel as well, so you can be part of the conversation. And the panelists are Dr. Crawford, Dr. Kevin Simon, who's our new Chief of Behavioral Health Officer at the Boston Public Health Commission, a new position that has been created, so just timely. Our very own Kwame Dance, who's now, he came to us as a doctoral student, and he's now Dr. Kwame Dance, PsyD, MBA, and the Dean of Health Arts Academy, and two of our patients, Marshall Simpson and Deshaun Gibson.
And before we jump into our panel discussion, just keep this in mind. So we're here today to recognize men in the community that are benefiting us and our patients. We're looking at how we can have ways to improve men's health, but also alongside our men, we also have to congratulate and thank the women, the young ladies, the girls in our lives as well. So, as Mr. Owens so eloquently represented, his daughter and his wife are key factors in his health and in his life. And so it's the same thing with our wives, children, mothers, aunts, so we have to recognize the women as well. So before we begin on some of the questions for our illustrious panel, I just wanted to read a statement that was provided by our very own Whittier Street Health Center's child psychiatrist, Dr. Hisham Hamado. He's traveling out of the country and he couldn't be here today, but asked that we share these sentiments before we jump off. During the COVID-19 pandemic, we witnessed firsthand the toll it has taken on the mental health of children and adolescents. Between social isolation, increases in rates of abuse and domestic violence, loss of income and financial stress, to loss of loved ones, to the pandemic itself, spending excessive time on electronics, children and their families have endured tremendous stress. This is further exacerbated by other social determinants of health that existed prior to the pandemic, including poverty, food insecurity, and limited access to health care. Additionally, we've witnessed that families from disadvantaged backgrounds did not have the same access to remote learning, leading to loss of educational attainment and more difficulty readjusting upon return to schools. We've also witnessed many moments of strength and resilience. Families have spent more time together, strengthened connections, and found joined purpose in enduring and overcoming adversity. Children have developed new hobbies, made new connections, and learned to appreciate school and social connections. So Dr. Hamado's words spoke to today's theme of building resiliency, community, and hope. And so with that, I would like to open up the panel questioning And thank you again, illustrious panel, for joining us. We've had our introductions. Let's just jump into it, shan't we? First question for us to think about. So first question, this is for each one of you. Would you please share your particular interest in participating in today's panel, and if, why the theme of building resiliency, community, and hope resonates with you? So why does that resonate with you? Why don't we begin our discussion? Anyone would like to start, or I can? Dr. Crawford, would you like to start?
Yes. To go back to your 3 points, I reversed it in my head. And that was hope, supported by community, builds resistance, resilience. Because without hope, you can't move forward. Right, Wes? Because one of that phrase was very important. And it was important that something that Wes said, because my high school teacher, who was a science teacher, said, Keith, you can do this. So from that phrase, I didn't go to medical school. Well, that was the voice in my head that said you can do this, whether it's at historically black college, because if you can go there, you can go out anywhere. And then in medical school, Texas, and then really the hardest academic challenge that I had in my whole life was at Harvard. And so, but the other point that I want to bring is this. I'm on the panel, and I give you another aspect of anxiety, of the need for mental health care. And that is when a patient is diagnosed with cancer. Now, respectfully, when we talk about breast cancer, women have a lot of support. Black women may not have that level of support. And women of color may not. But generally speaking, from the standpoint of breast cancer, there's a tremendous amount of support. But when you come to prostate cancer, we don't even talk about it. The President of the United States came to Boston and said, breast cancer, ovarian cancer, colorectal, and lung, and left prostate cancer out. So how would that make a man feel? Then the other problem that comes into play that's very important is how do you define a man? And what role, especially black men, where societal norms dictate how we look at ourselves. Handsome, muscular, strong. You may be good in sport. So, to me, when that's taken away, because in prostate cancer, the treatments remove one aspect of your masculinity. But again, that's the topic we need to talk about. But men need to recognize that you're not alone. Your loved ones, your family, these are all the points, those images that Wes left us with are so important. And what was very important for him to do was to talk to somebody that was important to him, his mom, or your caregiver. So that's why I'm on this panel.
Excellent, excellent. Thank you so much, Dr. Crawford. Thank you.
I'd like to chime in.
Yes, please do.
First and foremost, I want to say thank you for everyone that's here. I also would like to thank Christine and Carolyn for having me. It's a true appreciation to be on this panel. And Wes, you did an amazing job. I love everything that you said up there. That really resonated with me. I would like to say how this resonates with me is the fact that I'm on this panel. I think the fact that I'm on this panel is because everything that we endure as black men, everything that we hide as black men, because I mean, just simply put, we have to sometimes. You know, because the way people look at us, the way that we have to deliver at such a high level all the time. And I think that being on this panel is how we pay it forward. You know, how we're able to get on this panel, somebody else can see us, and then they can implement or maybe take heed at what we're doing, and now they want to get on the panel. So I think the way that we keep this thing going is by making sure that we have this awareness, we have these conversations, and we keep pushing forward. And just to touch upon something that Wes said, and I'm just gonna add a little bit to it, is that he said that it's okay, you know, to not be okay. I think I come from a strong basketball background. It's been my life forever. And something that Kevin Love said that I kind of loved was that it's okay to just be okay. You know, I think that sometimes we wake up and we feel like we have to be sad, or we have to be happy, or we have to have some type of emotion. But the truth is that it's okay to just be present and be in the moment and just enjoy everything that's going on. Something that you said, just like your breath, you know, the clothes on your body, shelter, your family. Those are things that I think that we just have to appreciate more. And I think when you have that sense of gratitude, I think every day is always a good day. You know, when you're just grateful. But that's just what I wanted to say.
Thank you. Thank you very much. So the question is, how does this theme of building... Oh, sorry. Oh, go right ahead. Yes. Go right ahead. Take your time.
First off, I feel honored to be on this and included in this discussion of powerful. You all are all powerful. And this center is a special place. Thank you for bringing me here. Christine, I'm going to talk about Christine for a second because only I'll talk about Christine for a second. But it was mentioned that I came here as a trainee first, and then I ended up working here as well as a clinician through the pandemic before that. But one of the things that Christine did for me as a supervisor, she was my supervisor, was really validate my voice. And that theme of validation has come up several times for us, so it's incredible. But actually, you know what, I'm going to ask y'all, especially folks who are parents, but anybody, what happens when, there's a famous study called the Blackface study, but I'm going to take us through it real quick. But what happens when a baby is hungry? Anyone can yell it out. What does a baby do when they're hungry and they're caregivers? They cry. That's right. That's right. And what's their expectation? Do they to get that? To get an email, right? Yeah. Cool. All right, we're on the same page. And what if the caregiver's there? Things are happening as they should. They get their need met, right? So what happens when the caregiver's present? They cry. Baby cries. Caregiver does nothing at all with that indifferent. They are indifferent. What happens? What's the baby do next? They cry. They cry louder, and then eventually what happens? Eventually after that, they sit alone. They holler. I think you can tell me if they stop. They shut down. Their voice shuts. They've been traumatically invalidated. So the fact that you all are up here and we are here listening to these brothers share their voices, I just want to let y'all know how that can be healing. That's how we prevent and reduce and heal trauma in our community. So last thing I'll say is because of the pandemic, masks, things like that, it's been really difficult for us to smile at each other, things like that. And that can be invalidating. You have the expectation, just like the baby did, that you were going to get your need met walking down the street by saying hello and getting that back and smiling. I said, we can't do that. So I want us to try extra hard, and this is why I'm on the panel. I want to try extra hard to acknowledge each other, especially brothers in the space. Smile if we can do that. Nod your head. Say hello. Those little things can really just make a huge difference. So,
Thank you. Yes.
Captain Simon, the reason that, one, thank you for this, and Whittier for having this men's health summit. So, by training, I'm a child and adolescent and adult psychiatrist, who also has training in addiction medicine. And as Wes pointed and everybody else pointed, pre-pandemic, we were seeing a lot of cases of anxiety, depression, suicide coming to Children's Hospital, and that just skyrocketed during the pandemic. I think for me, even when I go back to how did I get into the field of mental health and psychiatry, I'm from Brooklyn, New York, I'm Haitian American. I have family members like why mental health? Like, don't you want to go into medicine to do something bigger? And what I recognize clinically would be when I would talk to patients and I'd talk to families, there'd be simple, or what I might perceive to be simple things that parents could do or schools could do that weren't being done specifically for BIPOC or children of color. And so, you know, whether that's talking to your son or daughter, reading them a story at bedtime, having allowance for emotions, particularly in school settings, that's something that I think is critically important. And why a conversation like this is important is, you know, Wes mentioned he had a therapist, he called the crisis line, even during training, and to this day, Tuesday at 6 o'clock, I go to therapy. Wow. And and you know, one of the things that I think as a community we have to be able to understand is you don't have to seek help only during a crisis. If you seek help actually during times that are good, you're more likely to prevent a crisis. If you're having that conversation about what things are or are not happening to you. And so, you know, that's why I'm here. I love what Whittier does. And Linda Mayer inquired of this role. Mental health is a very large topic. All the social determinants of health connect to it: housing, economics, education, food. So, you know, I thought that if there is a city that could figure it out and figure out how to resolve it, it would be this city. So that's why I'm here.
Very good. Thank you. Thank you very much. Let's see. Mr. Woodson, did you want to add to that?
So, first off, thank you so much for inviting me to be here. I'm on this panel for really one reason only. I think my life mission is to bring the mental health conversation to places to be high most. And I think in the Black and BIPOC communities, that is one place where we see the largest disparity of where these conversations don't take place. So I'm just honored and thankful to be on this panel of this wonderful individuals to have these conversations specifically around mental health in the Black community. I love this, so thank you for having me here. I'm excited to continue the conversation.
Thank you very much. And Mr. Simpson?
Thank you.
Did you want to add to this, please?
Yes, sir. I believe, even though we're completely different individuals, the one thing that we have in common is there's a stigmatism with Black men revolved around mental health. When I look into everyone's eyes, I think of a quote that my grandmother said when I was talking about my father. Said, "Hey, he's never told me he loved me. He's a jerk. He's et cetera, et cetera." And she looked me dead in my face and she said, "Your father grew up in an era where Black men did not show affection or even knew what the word meant from a mental standpoint and just in general, we're going through society. We're taught that we have to be tough. We're taught that, you know, depending on the area that we live in, rather it's down south, that we have to be this kind of flair when it's in the urban, in the city. We have to show, okay, well, you know, who has this, who has that, and just other different areas. We're stuck in this one mindset that that we're staying away from the conversation of mental health all over the place, not just in Boston, but in New York and so on and so forth. And I come here every Wednesday, 10 o'clock, well, maybe not come in, because you can do your therapy sessions over the phone now. And it starts off by just making that first call, making that first step. Thank you.
Very good. Thank you very much.